I was diagnosed with HIV in 2002. What I started to realize through working at an organization called World in Oakland that served women living with HIV was that my experiences were really not unique. Women, especially women of color living with HIV, were suffering even within the context of systems that were supposed to be taking care of us because they were not set up to account for our sexual lives, our reproductive lives, our emotional lives, our family lives, our mental health needs. And so I became an organizer in order to shift that. Positive Women's Network USA was founded in 2008 by 28 women of very diverse experiences living with HIV. Our youngest founding member was 21, our oldest was 72. We had women who were born in the US, born outside the US, women who were trans, of trans experience. The one thing we all had in common was that we were all living with HIV. We came together because we realized that there was no other entity really speaking to our needs with a collective organized voice, and we needed to take the reins into our own hands to do that. Here in the US, women with HIV are living at the intersection of multiple oppressions. We live in a sexist patriarchal society. About 80% of women living with HIV are women of color, which means they're also impacted by racism. For women of trans experience, they're also living with transphobia, which often can lead to violence, in some cases deadly violence. Women with HIV are also living under conditions of state-sanctioned and structural violence against their communities. So, surveillance, racist policing practices, criminalization of black and brown bodies, criminalization of poor people. Our approach to health has never really been to address wellness and bring people into healing. It's always been to police people who appear to be deviant, and the bodies that are most commonly policed are bodies of low-income people of color, which is who women with HIV in the US are. In addition to that, women's bodies are different, our lives are different. Women who are diagnosed young may be thinking about how to create families, how to take care of their families, how to bear children, whether bearing children is an option, what they need to consider. Women who are aging, on the other hand, with HIV, are considering how to take into account menopause and which symptoms are actually menopause, which symptoms are actually HIV or something emerging from medications they're taking. And there's not a lot of research on that, unfortunately. I would argue that that's because women haven't been driving the agenda. Women have been trying to negotiate HIV prevention from an unequal playing field, right? So many women with HIV are also survivors of intimate partner violence. Even negotiating within the context of a relationship, historically all women had were male condoms mostly available to use. It's even hard to get female condoms, by the way, today on the market. And so a male condom means that your male partner has to know that it's being used, consent to using it, agree not to slip it off at some point. You know, there are a whole bunch of decision points that are not really within the context of a woman's control when it comes to HIV prevention. Unfortunately, PrEP hasn't really been marketed to women in the way that it could be, made available to women in the way that it could be. I would argue that that's also part of the way sexism and patriarchy shape the HIV response. If this epidemic affected white people at the rates it affects black people, we would have had a federal emergency response with corresponding levels of funding and resources and media. But also, medical providers are often making judgment calls about what scientific research they share with women. Discriminatory judgments based on perceptions about race and education level, formal education, and what their client or patient will be able to understand and what their client or patient may want to do with that information, sexually, in terms of substance use, in terms of having children. That is actually a travesty and a violation of women's sexual and reproductive rights. We know that basically women with HIV can conceive naturally. Women with HIV can have the families they want, when they want to, and all people with HIV, in fact, can. But a lot of women with HIV don't know that. Information is power, and a lack of information is actually a way of controlling human beings. HIV surveillance, HIV criminalization, a lack of information about sexual and reproductive options. These are just other ways to control the sexuality and reproductive choices of women living with HIV. The majority of women living with HIV in the US are living in extreme poverty. 70 to 80% of our members are living well under $20,000 a year. For many women, HIV itself has been a sentence to a lifetime of poverty. If they weren't poor before acquiring HIV, they damn sure are going to be poor now. And if you were a person who was having health challenges or didn't qualify for the type of employment that came with health insurance, which is a lot of kinds of employment in the US, you need to resort to using other kinds of social safety net programs, which are currently being dismantled. These social safety net programs require you to be poor. Some of them require you to have an AIDS diagnosis in order to qualify for them. That meant people with HIV were actually incentivized to get sicker and to be poorer before they could support themselves and, have access to medication, have access to housing, take care of their families. That is just an outrage. Education intersects with HIV in so many different ways, from the quality of education people have when making decisions about relationships, about sexuality, to the type of education available to medical providers and the ongoing education available to the HIV workforce. Many medical providers, especially today, don't know a lot about HIV. HIV criminalization is the practice of criminalizing non-disclosure, exposure, or transmission of HIV. Often, criminalization occurs even when no transmission occurred or was even possible. And here in the US, over 30 states and territories currently have laws criminalizing HIV on the books. So this affects a lot of people. And it affects women in unique ways. Women who are faced with HIV criminalization, even the threat of criminalization, may decide not to leave a violent, abusive, or controlling relationship. A woman who experiences criminalization, and this has happened to some of our members, may have their kids taken away, may lose custody rights, may be labeled as sex offenders and not even be able to go to their kids' schools to pick their kids up, may not be able to work in an occupation where children are around, which disproportionately impacts women. About a year ago, I had a member of Positive Women's Network call me in severe distress. She had been raped the night before, and she was deciding whether or not to go to the police to report this rape. She realized that she could actually be prosecuted for not disclosing her HIV status to her rapist. And as a result, she decided not to go forward. Here in the US, if you look at the leadership of most of the major HIV organizations that are getting the majority of funding, the majority of resources, and that are driving the sort of agenda for the response, from the political side to the research side, most of those institutions are led by white cisgender men who come from a legacy of access to power that is just not the reality of most women living with HIV in the US today. I think we are at a moment where women are really claiming power in a new way. Just sort of the surge in leadership by women living with HIV in all kinds of roles across the country, making decisions, making policies, crafting policies, developing their state AIDS plans, developing end the epidemic plans in their local jurisdictions, serving on their governors' advisory councils, and having formal, structured leadership roles within organizations and institutions. As women, we have always tended to see the epidemic as a symptom, not as the problem. The HIV epidemic is a symptom of human rights violations. It shines a spotlight on social inequities, disparities, and injustice, because that understanding is really innate to women, because of the different roles we hold in community. I think women are the best positioned to lead us out today.